Welcome to a new live transmission. This time we will be finishing this chapter on the immune system, chapter 6. Reminding us that we're reading this wonderful book, The Myth of Normal by Dr. Gabor Maté. For those of you who do not know me, my name is Angela Coates, and I am trained in compassionate inquiry, the therapeutic modality developed by Dr. Gabor Maté. And we join this Friday, each Friday. I'm a little bit late today, but I'm here, don't worry you guys, because I like reading this book and making some comments along the way. I'm also very happy to just answer your questions and we can look into this together. Let's get right into it. Grief and vexation. Mireille Bianca and multiple sclerosis. Mireille is a 51-year-old physician from Turkey, now working as a clinical trial coordinator at a Canadian hospital. She first experienced diplopia, double vision, at age 18, but without the advanced imaging techniques now available, she remained at first undiagnosed. I saw an ophthalmologist, and he said, "Oh, this is just a temporary thing," I recall. So I went on corticosteroids for 6 weeks and it went away. At 22, I had multiple attacks. Whenever I would see my mom, listen to this, I would see double. I studied in another city and was perfectly okay. But when I would go back to Istanbul, I would have another attack every time I saw my mom. At age 24, Mireille had an MRI that confirmed a diagnosis of multiple sclerosis. After she immigrated to Canada, she was symptom-free for years. But during her pregnancy, her husband, in the midst of some business woes, became abusive. He had this rage and hatred toward women, she said, and he would project it on me. One stress begat another. He wasn't making enough money to hire people, so I would work in the hospital from morning to afternoon. And then I had to go and mind the store from 4 until midnight. Can you imagine the amount of time and the amount of pressure she was going through, plus being pregnant? When I gave birth, things got worse. He was shouting, extremely angry. He was always demeaning me, mocking me, ridiculing me. Finally, Mireille left the marriage and after many years saw her parents again. When she did, she was soon unable to walk, a pattern that has persisted ever since. The emotional triggers of suppressed fear and anger instilled in her in childhood were activated around her family, and that in turn would inflame the nervous system. The reason I wanted to put that question in front of this live transmission is very simple. Is your nervous system inflamed? How has been your childhood experiences? And, most of us say, oh no, I had an amazing childhood. This and that came to my life. I traveled with my parents and so forth. But when we really honestly looked into it, and this is not to say that there's nothing wrong with parenting, but it is to actually acknowledge that there is trauma, that all of us have experienced trauma at some point in life. And again, not to punish or, bring blame on parenting and parents, that were doing the best they could with the resources, the emotional and wisdom resources they had. But we need to really make sure that we can understand our childhood in order to understand what's actually showing up in the body and how this body reaction is expressing itself. Multiple sclerosis is another autoimmune condition for which personal histories, childhood adversity, and the decisive influence of stress have been extensively studied. The first to describe this illness, the French physician Jean-Martin Charcot, sometimes called the father of modern neurology, proposed in 1872 that MS from long continued grief and vexation. As with his younger contemporary and fellow medical giant, William Osler's insight about rheumatoid arthritis, much information has been accrued to support Charcot's pioneering formulation. A majority of MS patients had grown up against an unhappy family background, found the 1958 study at 2 Montreal hospitals. By the way, I speak French because I used to live in Montreal for many years. Marital discord, broken homes, alcoholism, and lack of parental love and affection were given as reasons for unhappiness. The vast majority had suffered prolonged emotional stress prior to the onset of their disease. Also, salient and triggering relapses were such stresses as worry over financial matters, unhappy home life, increased responsibility, either alone or in combination with such other factors as fatigue, overexertion, overwork, accidents, injuries, and childbirth. A decade later, another study in which Dr. George Engel of the psychosocial coinage participated also concluded that the majority of patients reported psychological stressful experiences to have preceded the onset of the symptoms that ultimately led to the diagnosis of multiple sclerosis, findings corroborated by family members when available. The evidence just keeps coming. MS patients experiencing significant life stresses were seen to have a nearly quadrupled incidence of disease flare-ups. Finally, a major review of the literature presented at an international conference in Portugal in 2013 found a host of patterns among MS patients, including, and I will stop here for a second just to check if there are any comments or any messages, nothing at the moment, including, and take a note of this. First, more unwanted stress or traumatic events occurring between 6 months to 2 years before onset. A cumulative correlation between stress and relapse. After one stressful life event, the relapse risk doubles or triples. After 3 or more, the risk increases by 5 to nearly 7-fold. Histories of childhood trauma, and this is what I was referring to. Remember again, trauma is not what happens to you. Trauma is the way we're making meaning, interpretation behind the situation that we experienced. Histories of childhood trauma, which are double or triple those of the general population. Physical and sexual abuse histories correlated with higher relapse rates. Being less in touch with their emotions in general and therefore less able to protect themselves from stress, and social support mitigating the effect of life stresses. I wanted to stop for a moment and just mention the physical and sexual abuse histories. I would say that 95% of the people that I've seen in private therapy have accounted either physical or sexual abuse. And I can tell that this level of trauma is very important to be examined with the help of a therapist. Not because the person is not able to, find the healing journey and the healing resource to move along with their life, but those very painful experiences cannot be dealt on our own. If they could, the person would not be experiencing depression, anxiety, or MS in this case, or any other health conditional, name it mental or physical. Over the years, I've interviewed dozens of people with MS, many of them long before I was aware of such studies. I have yet to find an exception to these general findings. The long-continued grief and vexation, which Jean-Martin Charcot spoke a century and a half ago, factor meticulously in the presence and severity of the illness. As in other autoimmune conditions, in virtually every case, the childhood patterning that led people to be over-conscientiousness, hyper-responsible, and emotionally stoic about their own needs was evident. as where stress is preceding their illness, such as interpersonal conflict, family crisis, loss of a relationship, or added duties at work. Bianca, like Mireille, a physician, also had double vision, diplopia, as her first symptom of MS. Now 37, she experienced it in her 20s while she was stressing herself over her school examinations. Through the years, she told me, as we spoke online, she from her home in Bucharest and I in Vancouver, all the time that I had a symptom of double vision, I was preparing for exams or a lot of stress and work, professional stress. The other symptoms, I make the connection, like numbness and tingling or pins and needle sensations or paralyses, happen usually when I have personal problems and emotional problems. So can you see the correlation between the mind, emotions, and the body? Contrary to medical expectation, Bianca has made the disease work for her. She has learned to make friends with and allow herself to be instructed by a condition most of us would naturally regard as pure misfortune. I was overcompensating all my life and working hard and trying to please people, she told me. With MS, I finally had a reason to relax and focus on myself. Wow. Illness seems to be a curse. Illness seems to be something that is here to actually make us feel wrong, inadequate, or simply bad. But what if illness is here to knock on your door and to say, can you finally have a reason to relax and focus on yourself? This is very powerful. Why the rise of the autoimmune system? Autoimmune disease. Genetic explanations missing the mark. The hunt for elusive environmental factors, quote unquote, continues. In the modern world, there are bound to be many. I believe, however, that one of such factors is salient, ubiquitous, and for most the part woefully overlooked. Here, the very treatment of inflammatory conditions offers are essential. Even obvious clue about their origins, a hint that may help resolve the mystery of where in the world these illnesses came from. We physicians, speaks Gabor, frequently dole out large doses of synthesis stress hormones for inflammations of the skin, joints, brain, intestines, lungs, kidneys, and so on. We do so for a good reason. Hormones often alleviate or ameliorate symptoms, albeit with many potential hazardous side effects. Yet we rarely think to ask ourselves or our patient whether stress itself may, just may, have something to do with the condition we are treating. There is plenty of evidence for such a view. A recent Swedish study in the Journal of American Medical Association showed that people with stress-related disorders had significantly greater risk of autoimmune disease. Tellingly, those who had been treated for their stress-related mental conditions with SSRI-type medication, the most prescribed class of antidepressants, of which Prozac is probably the most famous, had lower risk for autoimmunity, a clear indication of the body-mind, to use Dr. Candace Pert's phrasing, for the inflow of psychology and physiology in humans, and of the role of emotions in illness. Not only humans either. Laboratory mice in a 2013 study were subjected to 3 weeks of stress, meant to mimic the diversity of stressful events in daily human life. That meant immersing the creatures in cold water, wafting predators or others in their direction, making them endure bright lights or restraint or isolation. Unpredictable stress of a variable duration they could not easily adapt to. The researchers call this chronic variable stress. Mice so exposed were found to be at an elevated risk for pathogenic autoimmunity. In other words, for immune activity directed against the physical self. Left in our current culture, I believe, makes many of us experimental mice subject to chronic variable stress beyond our control. A necessary caveat. In foregrounding the role of biographical factors in disease, we must be mindful to avoid blame or guilt. This is so important. We need to be mindful not to put blame or guilt on ourselves. Oh, there's a message here. Amoroso saludo, mi amada sobrina. That's my beautiful aunt. Do not place guilt or blame in our illnesses, okay? That's not going to help us. That's not compassionate. Some people see lupus as an external attacker. A British woman with lupus has written, but I prefer to think I did it to myself. And this is so powerful. You don't do it to yourself consciously. You don't. We don't go around our life saying like, I want to have lupus, I want to have depression, I want to have anxiety. No, no one does this unconsciously. This is an effect of ignorance, and ignorance from what? From wisdom, from the body, from our connection to our true source. Too much striving, too much living on the edge, too much stress. Yet, despite the consequences, I wouldn't change how I lived my life. It is who I am. So this disease is who I am too. There is wisdom in that view, but I also hear an unwarranted self-accusation and all too characteristic lack of self-compassion, says Gabor. No person is their disease, and no one did it to themselves, exactly what I just said, not in any conscious, deliberate, or culpable sense. Disease is an outcome of generations of suffering, of social conditions, of cultural conditions, of childhood trauma, of physiology bearing the brand of people's stresses and emotional histories, all interacting with the physical and psychological environment. It is often a manifestation of ingrained personality traits, yes, but that personality is not who we are any more than the illnesses to which it may predispose us. Yet, if a British writer errs in identifying entirely with her disease, she is still skillfully directing us to a profound and fruitful set of questions. Could it be that illness as quote unquote external attacker does not even exist when it comes to such chronic autoimmune conditions as we have looked in this chapter? What if disease is not in fact a fixed entity, but a dynamic process expressive of real lives in concrete situations? What new or old pathways of healing, unthinkable within the prevailing medical view, might follow from such a paradigmatic shift in perspective? And this is the end of this chapter, and I want to leave us with this. What if disease is a dynamic process expressing real life in concrete situations? What if we are experiencing depression and anxiety, and instead of blaming ourselves, except of putting the guilt because we are responsible for what we experience, what if we see it as a dynamic process that is leading to the expression of illness? It's not there to make you feel bad. It's not there to make you feel wrong. It has a deeper purpose. For some of us, it could be a wake-up call, letting us to slow down, to focus on ourselves, to see the way we have been living for decades. What if disease is here as a great friend? When you no longer need disease, it will go away. When you no longer need to be repeated that you need to slow down, to look into yourself and focus, it will go away. I wish you guys a wonderful weekend, and I'll be super happy to answer any questions, any comments. I've been getting tons of those in YouTube, and I'm looking forward to meeting you guys next week with the following chapter. Ciao, ciao. Take care.